All right, this is Dr. Michael Mueller, and today we are going to chat about size, right? We're going to talk about firmness and we're going to talk about length. And the question is, what are we talking about? Well, YouTube is a little sensitive with certain words. So today we're just going to talk about your, for lack of a better term, Johnson, right? Your Johnson. If you don't know what a Johnson is, please Google it. But nonetheless, I get lots of questions from patients. How can I make it bigger, right? How can I make it longer? Or how can I make it more firm? And we're going to talk about treatment options, right? And we're going to talk about things that might work, and we're going to talk about things that probably won't. So you should avoid them, okay? So we're going to talk about those things. Now, remember, folks, even though I'm a Mayo Clinic trained family physician with a extensive background in longevity and wellness medicine, I am not your physician. So if you need a physician, please see one. Everything here is for entertainment and education only, okay? So if you're having problems, right? Problems with that wonderful little tool, right? That tool that men love to use, right? If you're having problems with that, there are things that we can do to assist you, right? And a very common cause of an issue in that regard can be low testosterone. And a lot of people think about testosterone as sex and muscles. And certainly those are things that testosterone can help you with. But testosterone also can manifest as erectile dysfunction, right? So that's always step one. If someone comes in and they're 25 or they're 65 and they say, hey, things aren't working down there like they normally would, then we'll start with some basic labs to be sure that there's no issues with diabetes or other problems. And we'll also look at a testosterone level. And if that is low, then we treat it. And that's a video for another day. In fact, if you've missed my videos on testosterone, you can scroll down and take a peek at those where my videos are listed. So if the testosterone is normal, then we have to move on to the next step. And you always have to consider psychological factors, right? Because oftentimes when I see someone with ED, it'll happen once or twice. And then if it does happen, they become a little fixated on the matter. And that's absolutely normal. I get it, right? We want to be able to perform when we're supposed to perform, right? And if you don't, then you will worry about it, right? And if you worry, then you can bet things won't work. So the mental aspects of things is very important, as is the intimacy aspect of things, right? If the mood is right, if the chemistry is there, then typically everything will go well. But sometimes if you're young and you have this problem, you can use a medicine like Viagra or Cialis or Levitra for a couple of times, kind of get your confidence back. And then typically you can walk away from those medicines once you get where you need to be psychologically. But if you needed to use a Viagra or a Cialis or a medicine like this on occasion, that's perfectly fine. And as men get older, they can have issues where they have trouble maintaining erections, right? And that's where Viagra, Cialis, and Levitra can help out tremendously also. Okay, so those are three of the things that can be used if you're having a functional problem. And these meds can certainly help with firmness, right? They can improve the quality of your erection. They can help maintain it over a longer duration, and they can just make the whole event that much better. Okay, now those are PDE5 inhibitors, and these are kind of the standard medicines that we use in our business. And if you're new to my channel, folks, hit the like button and subscribe. I love medicine. I love helping people. And if you do follow my channel, then you know that I also like peptides, okay? And if you're not familiar with peptides, you should be, because we use peptides for weight loss. We use peptides to build muscle mass. We use peptides to burn body fat. And we can also use peptides to enhance your arousal and your libido. And unlike the medicines like Viagra, they work a little differently, okay? What they do is they work at your central nervous system to increase desire and to initiate the arousal response. And one of the most popular peptides we use is PT141, also known as Bremelanotide, Bremelanotide. And again, that's PT-141. And this one actually has an indication from the FDA to increase a woman's libido, but this thing also works quite nicely for men. The common dose for that is usually 1 milligrams. Done via subcutaneous injection. I actually will use 500 micrograms or even 200 microgram doses for many of my patients, a much smaller dose, because this peptide is often quite powerful. Okay, and I've had patients where they'll use this and it'll have an onset, within an hour or two, and then sometimes it can take 6, 7, or even 8 hours to work for my male patients. But it does work. In fact, you have to be careful with this one because it can cause a side effect called priapism, where you get an erection that can last for hours. If that were ever to happen, folks, that could be quite painful, and you would need to get that addressed by going to an ER. But again, none of this is medical advice. It's all for education and entertainment only. So PT141 can be quite helpful, and there's a sister peptide to it. It's kind of a precursor to PT141, and that is Melanotan, Melanotan. And this one does things similar to what PT141 does, but it also causes a nice little side effect. It makes you more tan. So if I were going to hit the beach later today, I could take a little dose of Melanotan and it's going to help me to tan. And it's also somewhat protective, meaning it will decrease your chances of getting sunburnt. And, a nice golden tan is always a good thing. So if your spouse or your loved one looks a little more tan and they're a little more in the mood, then you have to suspect that maybe, just maybe, they are using Melanotan, Melanotan 2, MT-2. So those peptides work wonderfully for arousal, for libido, and you can even use these in conjunction with a Levitra or a Viagra or a Cialis if you wanted to be sure that everything was working like you wanted it to work when that big event occurs, okay? Now, there are some other peptides that work inadvertently to help us with issues in regards to, our performance. And one of those is Kisspeptin 10, and that's Kisspeptin 10. And this is a peptide that stimulates your body, okay, to release GnRH, which is gonadotropin releasing hormone. And this increases LH and FSH, and this will bump up your testosterone levels. And as I mentioned earlier, if you can bump up the testosterone level, you should enhance or improve Johnson performance, right? Okay. And I know playing the funny word thing is funny, but you have to kind of be careful what you say here on YouTube. Another peptide that we use commonly is Gonadorelin, and this one helps maintain testicular function also. And by maintaining testicular function, you increase testosterone levels, and that will help you with libido, performance, and various other things. Clomiphene or enclomiphene, though, that's another one we can use, and I'll be making a video on that soon. And another peptide that helps with vascular health, it's a peptide that we use for tendinitis, ligament issues, musculoskeletal problems, and gastrointestinal issues. Another peptide that we use for those things can also help with erectile health by increasing the vessel angiogenesis, or the blood supply to the penis itself, and that's BPC157. And I've made multiple videos on those, so if you've missed it, please watch those videos. So folks, these are some medicines that we can use. These are some peptides that we can use to help enhance your performance, to help make things a little firmer, a little stronger, and maybe even a little longer. I mean, in essence, if you think about it, the penis itself is a balloon. Blood goes in and blows it up, and blood goes out and things go down. And many of these medicines can help enhance that process. And by doing so, you're going to get a little benefit when it comes to size and length and firmness, okay? And that's why we talk about these things on my channel. Now, there are some injectables you can use. There's Trimix, there's Bimix, and there's Quadmix. These things are beyond the scope of today's video, so we're not going to dig into those. But folks, if you're new to my channel, please hit the like button and subscribe. I'll be back at you soon. We're going to touch upon this topic more because there are more things I can offer you to help with any issue that might arise around your you know what. So thanks for listening, folks. I'll be back at you soon. Have a great day.